Hi, everybody. Today I have with me Dr. Chinyere again, talking
Hello.
about some very important health issues with women, right? Dr. Chinyere, welcome once more.
Thank you. Thanks for having me.
Good to see you again.
Yes, it's nice to be back.
Oh, yes. So we were talking about the pelvic floor and the weakness of the pelvic floor, right?
Mhm.
So can
Yes.
you start off by helping to describe what the pelvic floor is and how it
Okay.
affects men and women when it's weak?
Okay. All right. So perfect. So,
Thank you.
so once again, thanks for having me on your show. The pelvic floor is basically something that both men and women have. The best way to think of the pelvic floor is to think that you have certain organs. So women have their uterus, they have the vagina, they have the rectum, and these organs sit on a foundation. So if you think the pelvic floor is like a little like a trampoline, and everything sits on top of that. Okay. Men also have some organs in their pelvic floor area. So men also have their bladder, they have their rectum, but they also have the prostate. And so this pelvic floor muscles are supposed to be very strong, and they're supposed to kind of move with us and just allow us to be able to empty our bowel movements, empty our bowels properly, and also be able to urinate properly. But sometimes these muscles
Yeah.
will become weak for different reasons. And so when these muscles become weak, people start to experience symptoms. So I know today we're
Yeah.
focusing mainly on women, but just real quick for men, when they are experiencing pelvic floor weakness, they might have some issues with urinary leakage, so leaking urine. They may notice that they may have some pain or pressure in their testicular area. They might also have some problems with erection or pain with intercourse also. So those are some symptoms
Yeah.
that men can experience with pelvic floor weakness. With women, though, women will also experience some similar symptoms. So some women can start to notice that they're leaking urine. So, for example, if they sneeze or they cough or maybe they bend to pick up something, they will notice that they will squirt out a little bit of urine. Some women might
Yeah.
notice that they're not able to hold their bowel movements very well. So maybe they bend to pick something and they will mistakenly pass gas. So that's another sign that could of pelvic floor weakness. Some people
Okay.
might find also that maybe they go to have a bowel movement and it's a little bit, it feels as though something is obstructing or blocking their bowels from passing because those muscles are weak and causing a bit of a bulge in that pelvic floor area. So that is something else
Hmm.
that can impact women. Some women in like really advanced situations will start to feel a lot of pressure in the vaginal area, and they may even feel as though something is going to fall out or protrude from the vaginal area. And that's something some other
Wow.
women can experience. And some women can also notice that maybe during intercourse that maybe they don't get that satisfaction that they used to get because the muscles are a little bit weak. So this is something that is very, very common in a lot of people, but not something that we don't always
Wow.
talk about, right? And
I
I know, like
see.
for myself in my practice, it wasn't something that I always would ask my patients when they come in for their checkups, right? And then a few years ago, I heard the statistic, and that statistic was saying how what is it, like 4 out of 10 women would experience something, these kind of symptoms, but it could take them up
Yeah.
to 8 years before they get the confidence to talk to their doctor. And I thought, wow, I know, right? To suffer like that. And, a lot of times we have these
Yes.
misconceptions. We're like, oh, after all, I've had children, so it's okay. I know I should be peeing and wetting up myself. And it's like, oh, no, you really shouldn't be doing that. So I think it's just something that we need to bring to people's awareness to know that, okay, these are things that you're experiencing. And then, we should know how can we try to help these things, the
Yes.
situation. Yeah. Are you familiar with, you
It's
weren't very familiar with this when I brought this topic to your attention.
exactly. I was actually like, I've never really thought about this.
Yeah.
So can you help us enlighten us? How does this happen? What causes the pelvic floor to get weak? What are the things responsible for?
Okay, so there are different things that can cause the pelvic floor to get weak, right? So one of the most common things is being pregnant. Okay, so
Okay.
when you're pregnant, your uterus pushes against your bladder. So over time, that can cause that bladder to be weak. Then when you go into child delivery or labor, as it's commonly called, and you're trying to push the baby out. So if you have a very prolonged labor, that can also cause the pelvic floor to get weakened. Or maybe you deliver a baby, like you have a vaginal delivery and you deliver a very big baby. That can also cause some issues with the pelvic floor. But even women that have had cesarean sections can also, later in time experience some weakness with or pelvic floor weakness. Sorry. The other thing that can cause pelvic floor weakness is being constipated, like chronically constipated. So you're sitting on the toilet for a long time, always pushing, straining to have a bowel movement. That's something else that can cause this. Age. So as we get older, our muscles get a little bit weaker. So there's that factor of age that can also affect it. Sometimes people have certain medical conditions, right? Maybe some people, for example, maybe they've had maybe a cancer and they've had to have certain treatments. So sometimes those treatments, can contribute to the weakness of the pelvic floor.
Wow.
Yeah.
So the pelvic floor weakness in a woman's body now, in a woman's situation, it's repairable or it's not repairable? What's the fix?
Okay, so it depends on how advanced things are, right? So in the very early stages, when you're starting to notice that you're starting to leak a little bit of urine, you can actually start to do exercises to try to help your pelvic floor to get strong, right? So for example, there are things that are called Kegel exercises, so Kegel, so Kegel exercises. Yes. So that can help to try to strengthen your pelvic floor. So the best way to think of a Kegel exercise is, when you're in the process of urinating and you want to stop your urine from flowing, that action that you have to do and those muscles that you have to tighten, that would be what a Kegel exercise is. There are physiotherapists that can also, help you to learn these exercises, or you can find them easily on YouTube or other platforms. The other things that can be done would be also really working on your fiber intake, making sure that you have soft bowel movement so you're not straining. The other thing that I often tell my patients to do is to get a small stool, like a step stool that they can put in front of their toilet. So when they're sitting on the toilet, they'll put their feet on the step stool. And so that just kind of keeps your body in a good position so that when you're trying to have a bowel movement, you're not putting too much pressure on those organs. So those are things that can help. If it gets really bad, where maybe to the point where the woman is starting to notice this protrusion of the vaginal organs, coming out of them, so we call that a prolapse. So in those kind of situations, if it's a very mild prolapse, there's some devices that are sold that are rubber devices that can be inserted into the woman's vaginal area to hold, the uterus up, kind of exactly acts like a suspension. Yeah. Or if things get really bad, then some women have to have surgery to try to help to fix it. But my whole point or my whole thing is that it's always better to try to prevent things before they get, really bad, right? And so I always just try to encourage people, when you're pregnant, start doing those Kegel exercises, start trying to strengthen your pelvic floor. After you've had your baby, you've recovered, maybe about 6 to 8 weeks after you've recovered, start doing those exercises again to try to strengthen that pelvic floor. And just through your life, you always want to just be trying to be very conscious of keeping that pelvic floor very strong,
Okay, I see. So that's I get the logic here. The logic is to, while being pregnant, which is the main cause, like you said now for this, right? You should be doing these exercises, right?
Yes. Yeah.
That will help prevent the situation.
Correct.
For many people.
Yes.
Right. And secondly, if people develop this situation, they should be quick to talk about it before it gets to the complicated stage.
Yes.
Where there might be need for surgery and all of that.
Because you have to understand too that when someone is leaking urine on themselves, it's not just the fact that you're leaking urine. There's so many things that come with that. There's the odor of urine. There's that embarrassment that, oh my goodness, I've soiled my clothes. There's some women that have to carry extra underwear because maybe they've soiled themselves, or some people, they're wearing pads or liners on their underwear to try to contain things. So there's a lot, there's a emotional component, there's a psychological component, because you can, after a while, can even start to feel depressed because of these changes. And so something really important that I think people need to bring to the attention of their doctor and let the doctor know that this is something that they're dealing with, so that the doctor can try to help them in this with this matter or this situation.
And I remember what we were talking about the other day that brought about this pelvic floor weakness. We're talking about exercises and women. Then we spoke about squats and things, and you were explaining to me how some women have this condition and they would not probably want to go to the gym for this reason, because they're not confident that they would not mess themselves up and things like that, right? So a lot of women avoid going to the gym secretly
Exactly.
because of this. They won't tell you, but this is one of the reasons why, right?
Exactly. Exactly. Or they'll avoid things like even jumping jacks. They don't want to
Yes,
do a jumping jack or even
yes,
burpees. They don't want to do those things, right? Because they feel like, okay, I might not be able to hold my bladder in that situation.
yes.
Yeah.
So the exercise you just described now is just that simple, right?
Yeah.
The Kegel exercise, just holding it in.
Yes.
So let's imagine now we're talking to somebody now. Here is our person here, and she has this
Okay.
condition. What will you tell
Mhm.
her to do? Let's
Okay.
describe it so that somebody can actually just do this. What will you tell her
Okay.
to do? How many times a day? How
Okay.
many sets? For how many minutes or how many seconds will she hold it? And can you
Okay.
describe it in
Okay.
a
So
way
the
that will produce results? And how should she? Sorry, how should she monitor her progress? You know that
okay.
okay, I'm actually getting better. What are the signs to look
Okay.
out for? Yeah.
Okay, all right. So I think the first thing would be for them to be able to identify which muscle they need to be working on, right? So like I said,
Okay.
so the first thing I would say to somebody is the very first time you want to do it when you're sitting on the toilet peeing, right? So you
Yeah.
just want to like as you're peeing, just try and stop your urine just to get a sense of what muscles you're trying to identify. So once you do that, you don't want to always be sitting on the toilet and holding your urine because that can cause other issues like, put you at risk
Yes.
for infections and stuff. But just maybe then
Yes.
the first couple of times just to know which muscles you're trying to identify. Then, you can now do these exercises. You can be sitting down, you can be standing. It doesn't really matter when you're doing these exercises. So
Sorry,
what you want,
Chinyere.
Mhm.
Can you pause? Let's take it one by one. So if you are on the
Okay.
toilet sitting and you stop, you are able to. So the question I want to see whether I'm following you. You want
Yes.
to see whether you're going to be able to stop the urine from flowing out when it's about to flow out, right?
Yes.
So there's going to be two options. Either you're actually successful in doing that, or you're not able to control it, right?
Mhm.
So what is the meaning of each, and
Okay.
what muscle is going to be responsible for that, so that people can know?
Okay. So
Yeah,
so basically what it is that like when you're sitting and you're peeing and then you try to like stop and hold those muscles, it gives you a sense of like,
yeah,
first how strong is my bladder? And it's not really very easy to stop your urine sometimes when you're trying to urinate. So it just
yes,
gives you a sense of how
yes,
strong your bladder is. But really it's also just giving you that idea of this is a kind of sensation, this is the area of the body that needs to be feeling as though it's contracting
yes,
when I'm doing these exercises, when I'm not sitting on the
yes,
toilet. Okay.
yes.
Now, if, for example, somebody tries to do it and they're not able to stop their urine, usually at that point in time, I would say maybe that particular individual needs to go and see their doctor and do some other testing, right? Because that person might need more therapy than what these Kegel exercises can do. Okay, so when you're not able
Okay,
to stop your urine, it's usually a little bit more of an advanced situation. Okay.
okay. So that's the first test, like a litmus test to know exactly what's going on, right? To
Yes.
know what
Yeah.
stage, let me put it that way, to know what stage you're at. So
Exactly.
if you're able to stop it, then you know that okay, you have some control of your bladder in a sense, right?
Yes. Okay. Yeah.
Okay.
And then
Continue,
so
please.
now then
Okay.
what you'd want to do is that you'd your day-to-day life, for example, sitting on the chair driving, if you're standing in the kitchen, you would now want to
Yeah.
try to like pull those vaginal muscles in and hold them for
Okay.
about 5 to 10 seconds, right? And so one
Yeah.
one thing that I think helps to make this Kegel exercise a little bit more effective is as you're pulling in your vaginal area, you also try to pull your belly button and hold your belly button inwards. Okay, so that's going to really try and tighten those abdominal muscles.
Oh, like
Okay.
like like a vacuum, right? So you're doing like
Yes.
a full core exercise. So
Yes.
you suck your belly in, right?
Yes.
While
Trying to
also
pull.
contract your vaginal muscles, right?
Exactly. Yep. And then you're going to do that and try and hold it for about 10 seconds, relax it, and then you're going to repeat that again. Okay. And so the idea is to try to do in a day about 50 to 100 of those in a day. Okay. And
Wow.
so, and what you can do is just break it into chunks, right? So you can try and do like,
Yes.
maybe 20, 30, and then at another point in time in your day, maybe at lunchtime, you can do it again. And so so what you'd want to do is that you'd want to be very consistent with this type of exercise because it's not something that is going to make a difference to your bladder or your pelvic floor health in a day. It will actually take a few
Yes.
weeks before you start noticing that things are getting better. What you're going to be looking
Yes.
for to see if you're starting to get better is, okay, I went to go I sneeze. I didn't realize I was going to sneeze and I just sneezed. Did I have to cross my leg and hold my leg to prevent myself from peeing? because that's usually one sign that your bladder is weak. So if you're realizing that, oh, you know what, I was able to sneeze and I sneezed and I didn't actually dribble on myself, then you know that it's starting to work, right? But also the thing is that these are exercises that when you start doing them, you're not going to say, okay, I'm going to do them for 6 weeks and then I'm completely done for the rest of my life. This is something that you want to do on an ongoing basis, right? That even once you get your bladder feeling better, even if you're not doing 50 to 100 in a day, but you're thinking, okay, I'm aiming for 10 to 30 in a day, just to try to really keep that pelvic floor really strong. That would be something that I would encourage people to do.
Interesting.
Yeah.
Very, very interesting. Thank you so much, Dr. Chinyere. So women out there, this is pretty clear knowledge right now. So there's no point trying to hide this fact or being ashamed about it. The sooner you deal with it, the better.
Exactly. Exactly. Yes. And then, just really the other things that we want to do, like I've said, like when you're eating a high fiber diet, that really, I think at the end of the day means that you're trying to eat healthier, right? So trying to maintain, keep your body like healthy. There's also, a factor too that I forgot to mention initially where, if we're carrying a lot of abdominal obesity, so a lot of fat or weight on our abdominal area, that extra weight or fat can also put pressure on our pelvic floor and can also cause weakening of these muscles, right? So we want to, as we're eating healthy, hopefully we'll be able to lose some of that weight that we're carrying on the abdominal area. And that will also, losing weight will also be something that would be able help your pelvic floor to also get stronger.
So the diet also should be observed that you have to take high fiber diets.
Yes.
Eating healthier will help this with this situation, right? Eating healthier will help the situation, and eating poorly can worsen it indirectly, right?
Indirectly, yes, right? Because eating poorly, then we're probably eating a lot of processed foods or foods that are not healthy, and just in general, those are just never really good for us, right? So you might gain weight from eating, a diet that's full of processed foods. So it's better to try to eat healthier. And when you're aiming for high fiber, I always think like you want to be aiming for 20 to 30 grams of fiber in your day, which is a lot of fiber. So that might entail that you maybe need to eat take a fiber supplement to try to help, or just eat lots of fruits and lots of vegetables.
For those who are not able to actually consume that amount, right?
Yes.
Because I get it.
Yeah.
Very
because the whole thing is that we just don't want to be sitting and straining on the toilet also, right? So high fiber is really good. Yeah.
So in summary, a big midsection has a lot of downsides, right?
Yeah.
Beyond just aesthetics, right?
Yes.
Because you're putting a lot of pressure on a lot of organs, and that is the long and short of this.
Yeah. Yeah.
So pregnancy is something that you don't have control over. Pregnancy is a natural phenomenon, and if you're pregnant, you're definitely going to have a big quote unquote midsection. So there's definitely going to be much more weight there. So that's natural, and that's why you must do these things proactively when you are pregnant, right? Yes. But outside of pregnancy, you have to watch your belly weight because of this same thing, right?
And any woman will tell you that it's so hard to lose that weight around your midsection, right? Like there's some people that are able to do it like, very easily, but for the most part, I would say it's very, very difficult, right? But, you just don't want to give up. You just want to just keep trying, keep doing your exercises, keep eating healthy, and just doing your best to try to, reduce some of that weight that we're carrying on the midsection. And like you said, though, when we carry weight on the midsection, it can put us at risk for other things like, like pre-diabetes, and so some other things, you can have low back pain. So there are so many other, like you said, so many other issues that are associated. So it's never to our advantage if we're carrying a lot of weight on our midsection.
Yes.